Hello and welcome to TMBtalk, a concise talk on the current outbreak of conjunctivitis across India. With persistent rain, cases of conjunctivitis or pink eye are on the rise in several parts of the country, including the state of Manipur. We're here at the state's top hospital, RIMS Imphal. Today, we'll try to comprehend what is this infection. I'm joined by Dr. Y. Chingsrigamba Maite, Head of Department of Ophthalmology. Thank you for your time, sir. So, the basic question, what is conjunctivitis, its symptoms, its causes, and the preventive measures?
Okay. This very good afternoon, and this conjunctivitis is basically scientifically it is we describe this as keratoconjunctivitis. We call it this as epidemic keratoconjunctivitis. Keratoconjunctivitis, if you say it is an infection or inflammation of two structures. One is the kera part, that is the cornea, and the other one is conjunctivitis. If you say is the conjunctiva, that is the whitish membrane that you can see around that. So inflammation of these two main structures in the eye is known as keratoconjunctivitis. Now we have an ongoing epidemic going on. Basically it started I think in the mainland, I think about a month back. It is now squeezed down and started affecting the northeast, including that our state. In the last about couple of weeks, we are seeing quite a lot of cases.
So, is conjunctivitis like common in India and mostly happen in the rainy season?
No, conjunctivitis, if you say, is something which can occur from many etiology, from many causes. You have so many varieties of conjunctivitis, but this is the one current wave of conjunctivitis that is going on. This is an epidemic keratoconjunctivitis. This is quite. This occurs from time to time, actually, especially during this humid, rainy seasons. This is attributed to one of the adenoviruses. This occurs from time to time, maybe about 1 year or maybe.
Is it caused by a virus or a bacteria?
This is the current wave of epidemic keratoconjunctivitis is caused by adenovirus. It's an infection basically. It is an infection. It's highly infective.
So, like, how many cases, till today registered in your own department?
I am not very sure about what is going on but last I think 3-4 days or last about a week, we have been going quite a tremendous footfall. Yesterday was a holiday, Sunday, but I think in the casualty, I think my residents are reporting that they have seen about 70 cases. That's quite a huge number to be seen. And today in the OPD we have. I was there in the OPD. We have a total number of 275 outpatient patients, for ophthalmology. Out of that, I think we had, well over about nearly 100 cases of this epidemic keratoconjunctivitis. Quite a lot of, and most of them, the age profile were all, I think, in the younger group, I think, and many of the parents were. They told me that when the children came back from school, they carried this infection. So I think from the homes, from the this thing, it is spreading, I think, in the school.
Is it an alarming stays in the state of Manipur for this contagious disease?
The bad part, there's a good part actually. I'll tell you the bad part first. Actually, it is quite contagious. That means it can be quite. If one of the family members get affected, it's very likely that the others also will this thing, unless you do some very strict hygienic protocols. That I'll be coming to that later on. The good part is this is most of the time is a self-limiting infection. Actually, patients are not feeling well. Their productivity will be less for about a week or so, but Most of the time, about 99% of these cases does not leave any permanent damage. So actually, that's the good part of the thing.
It doesn't affect the eyesight at all.
Most of the time, it does not cause a permanent damage. Most of the time, yes.
So, how can a patient, like anyone who is suffering from conjunctivitis, how can he possibly understand it is conjunctivitis? What are its symptoms?
So the first thing the patient will have is some kind of itching sensation, watering, and then they have this very commonly this not being photophobia or intolerance to light. They have this glare, they can't look at bright light, and then this redness will come in. A gritty kind of a sensation of foreign body. If you talk in Manipuri, they say, kieng ba hai batare ko, koigi maiteron da hairagadi kieng ba, like something has gotten into the eye, and then you feel this foreign body sensation. And then the redness will start, there will be profuse discharge can be there, koigi misang ziyam kaba. So these are the spectrum. Actually, we grade into these mild symptoms and then moderate diseases and severe diseases. Only problem with this disease is most of the time the infection is confined to the conjunctiva, then it is safe and sound. Of course, for the fact that you are having discomfort, you are having, you will be disturbed from doing your normal chores of work. So for that, this thing is there. But unless the problem starts when, this spreads to the cornea, basically, the cornea is that bright, shiny part of the eye that we see right in front. So if that gets affected, then maybe you will have a little problem. So we need good medication for that. But with medication, that can also be very much treated.
Okay, like it normally, how many days it will take to go away the redness?
Usually it's about a week or so. With about a week maximum, about in 10 days time, I think it should be true. One should be true. But if you are fallen victim to this condition, you can be this thing that depending, of course, as I said, what kind of disease you are having, the mild one, the moderate one. So on an average, maybe about 5 to 6 days, probably I think your routine work will be quite disturbed. After that, I think most of the time patients recover.
So like, is it dangerous?
Dangerous in the sense, yes. When it can affect the cornea, then it can have certain sequelae, especially, patients who are immunocompromised, actually, patients.
Lastly, sir, like what everybody want to know from you is what are the preventive measures that can be taken off to actually prevent this infection?
Yes, that is very important because this is something, most of the time this is a moderate, disease which does not leave much of a permanent damage. So, but when it gets to you, you are out of work for a few days, so that's not a very pleasant thing to happen. So prevention is quite purpose. The best way is to maintain hygiene, basically, in the sense that you have to be, the basic personal hygiene, like if you wash your hands regularly, while teaching, and then not touching your eyes most of the time, like that. That's a regular hygiene procedure that one can maintain with the soap wash, with the hand wash with soaps. That's quite good in itself, without any infection. Once you are in a close proximity of an infected person, it's become all the more important that you maintain a very good hygiene. Try to stay away from infected guys, okay? And if you have infected persons, so not that, it is it's not something like the COVID, this thing that you go very near and then you get, no, it's not that, but you should be careful, wary about, if you have touched something on his personal belongings or something like that, you have to wash
only when we are in contact with.
Yes, that is very important. Another thing is, if one of your family members get affected, let him be slightly segregated. Don't share the towels. Okay, we have this in Manipuri society, we have this thing of sharing the towel, the fadi, actually, so everybody rubs. And so somebody wants, if they're infected, then I think his best thing is to keep him let him sleep also in a separate bed. If you can afford that, that would be good, because from touch and this is going to occur, Okay, so these are the important things that we need to maintain. And as soon as the infection occurs, many of the thing, they do self-medication, but most of the time actually it is self-limiting. But as I said earlier in my earlier part of our discussion, that sometimes some of them tend, if they can affect a structure known as the cornea, and a common man would be not knowing that, so that would have some consequences. So it's always better to see a qualified eye specialist, when you have this infection. Another thing is patients who are on contact lens wearer and all. I think best thing is to keep away from contact lens for the time being. If you are having any infection, or if somebody nearby is having the infection, best to avoid contact lens for the time being. So these are the basic measures: washing your hands, putting your medicines regularly, separating, staying away from infected persons. These are the basic hygiene and this thing. Otherwise, you can get along with the normal day-to-day activities. There is no big this thing that to be taken.
Okay, so there is nothing much serious about this infection.
Most of them are inconsequential. I mean, in the sense that permanent damage is late. Aduna yamna ahoina masi tore hana hekta kibadudi, it is not required, but ahoina hak tawring ai manungda di si mangba khotpa akhoi thabak suba ngamdaba du tawduna nuaibadi na tabna yaringai tawhandabadi phai.
So does it require oral medication?
Oral medications are most of the time is not required. Most of the time they can be treated with simple eye medications, which can be put as in the form of drops and ointments. Some of the patients might have a slight, yes, on that context, some of these, in the initial, because this is a viral infection, so some of them might have a slight, systemic effects, like mild feverish kind of a feeling, like in common cold, that kind of feeling. Some of the patients will feel that. In that case, antivirals and other things are usually not required, but you can take symptomatic relief tablet paracetamol, or if the patient is a child, then in the form of suspension paracetamol, I mean as normal paracetamol medications can be taken orally.
Thank you so much, Doctor. This is TMB News. We're grateful for Dr. Jingsui Ngamba of Department of Ophthalmology, RIMS, Imphal.